The healthcare dynamic is rapidly changing. Understanding the basic fundamentals related to the business of medicine empowers practitioners to advance their skills in and knowledge of the business aspects of medicine. SMA's Business of Medicine Simplified program explores the essentials of everything from reimbursement and compensation models, insurance and risk management, to practice employment and business finance.
Welcome to another SMA Business of Medicine podcast. I'm glad to be here. My name is James Richardson. I am the SMA's Property and Casualty Insurance Program Administrator. So we take a deeper dive into insurance issues around medicine, whether that be a practice, a facility, an individual physician, and bring you new things that are happening in the industry. And today we have a guest that you're really going to get a lot out of. Tim Boyce is the healthcare practice leader at CFC Underwriting Limited. That's a specialty insurer in London. Tim's bio, his team developed the first bespoke insurance policy for telemedicine companies, which combines medical malpractice, tech E&O, cyber, and general liability. CFC are currently the largest specialty insurer of telemedicine providers globally, servicing over 1,000 insureds who offer services across 80 countries. So the reason we wanted to bring Tim in today is because of the emergence through COVID of telemedicine. Telemedicine was on an upward trajectory already, but a lot of practices and facilities and docs that have wanted to use telemedicine, that got ramped up by about 5 to 10 years in the space of 6 months because of the COVID pandemic. There are a lot of also traditional platforms that are maybe not using telemedicine, but they're starting to use more technology in-house. They're starting to use more equipment with a digital platform in-house, and that also leads to questions. So as I talk to SMA members throughout the last few months, those are the questions that I get: is how does all this play in, all the new stuff we're doing, all the things we're bringing into our practice, how does that set up with our current insurance policies? And that's why we wanted Tim to come, because CFC has developed something that brings all of that into one program that's going to make sure there are no gaps, make sure that gray area is taken care of. Tim, I'm glad you could be here and spend a little time with us. And I think probably the best place to start is let's talk about the evolution of telemedicine and what COVID has brought on.
Thanks, James, and thanks very much for having me as well. Really appreciate you guys. I mean, certainly with COVID-19, we've seen that it's provided a huge sort of external shock to many industries, but maybe none more so than healthcare. It's very much sort of shattered decades of old assumptions about how treatment should be offered. And certainly in the last 6 to sort of 8 months, we've seen sweeping changes in the delivery of care. And telemedicine has been more sort of widely adopted, both by the traditional healthcare providers and also the sort of 21st century providers as well. I mean, one of the startling statistics I saw quite recently was that last year, many people were predicting telemedicine consultations to rise from 36 million to about 200 million in 2020. So a pretty huge categorical rise there. But actually what's happened because of COVID, this has risen to about 1 billion telehealth consults this year alone. And it's really gathering pace and steam. And we really see no sort of no slowing to the uptake as well.
Well, I'm sure that's going to be the case, and it's going to continue. And I think that's the thing that kind of keeps practice managers and physicians up at night is things are evolving so quickly that it's hard to stay in front of it from a risk perspective. They're buying their traditional products, but they're not sure if what they're doing fits into that. They're asking questions that some people in the insurance industry can't even answer. So you get to see a lot of the new and emerging risk and the things that are coming down the pike. So what are your people telling you about those risks moving forward?
Yeah, it's a good question. And I think certainly telemedicine has been proven to not be perfect. There are definitely certain weaknesses and limitations of the model. But these have very much sort of been magnified during the pandemic. And one of the illnesses that can't be diagnosed electronically is something like cancer. And certainly we don't really know what the true repercussions of that and what they may well be in the fullness of time. So that is one concern that we have. Obviously, sort of simple checkups and things, a lot of the time assessments can't be fully done electronically. So there are certain limitations to that model, and with limitations will bring additional risk. I also think where providers have flipped to a remote working model as well, there will be additional emerging risks, which we can talk about a little bit more later, but certainly with regards to things like privacy controls, as well as companies start to flip to an online model for their clinical services.
I also see that there's a question about licensing that you may, through telemedicine, get outside of your purview of what your specialty is. Have you seen that before?
Yeah, it's definitely becoming more common. Some of the licensing rules were partly relaxed in the early stages of the pandemic, so that providers could treat patients across borders and across different states, and also across territories as well. So where you had US-based healthcare providers that are offering services to patients, maybe in Canada or even in Mexico. So we saw a loosening of some of those licensing requirements, or temporary licenses being offered. But what we're envisaging and what we've started to see already is, as those licensing restrictions come back into place, we're going to start to see more sort of board action complaints and hearings as providers maybe hadn't done the required in-person consultations prior to offering telehealth services in certain states. So I think one of the difficulties with telemedicine is certainly the varying degrees of licensing requirements and assessments by state. So often we see a lot of telehealth providers that are maybe licensed in 20 different states, but each one of those states has their own requirements to offer services remotely to patients, and it's quite difficult for providers to be on the cutting edge of those changes as well. So we're envisaging that a lot more board action complaints and hearings will be forthcoming, and the costs associated with those will start to ramp up.
Let me ask you, and kind of jump down a rabbit hole of something you brought up, which you may or may not have a lot of insight on. But in our last podcast about medical malpractice, COVID had just really kicked off, and the states were scrambling to give this liability immunity in different scopes in different states. What are you seeing there? They are pulling those back now, or are those still fully ramped up?
Yes, I think that's in regards to the PrEP Act, and obviously the PrEP Act only goes so far, right? So companies can still be sued in the event that they're sort of grossly negligent. I don't think it provides a complete defensibility argument. It's not a complete shield, if you like, for some of the healthcare providers. It doesn't give them complete immunity. Do I think that we'll have complete immunity for all healthcare providers across all states, across all jurisdictions? Absolutely not, no. And I think we've started to see it already. There's a recent article I saw the other day where it said that already 50 long-term care facilities in the US have been sued for negligence because patients contracted COVID on the senior care facilities watch. So I think that's definitely going to become a bigger theme for the next sort of 12 to 24 months, and maybe even in the long term as well.
It definitely will be. Let's dive into your particular product and why we brought you on here, and why it is a little bit different than what we've seen in the past. So what Tim has with CFC is kind of an all-encompassing product, one that takes away what I was talking about earlier, takes away gray areas, takes away gaps that may be between certain coverages that you have. So traditionally, Tim, we talk about medical malpractice and your traditional products, which may be cyber liability, general liability, those siloed insurance products that have a certain level of coverage, a certain width of coverage, and certain exclusions that they hold in-house. So I'm assuming after going through in detail your product, this is something that is probably going to be more of an industry focus moving forward, as the design of what an insurance product looks like is going to change based on today's reality.
Yeah, and I think the key thing here is that obviously sort of traditional solutions are certainly built for traditional healthcare providers, and they're very much sort of rigid in their scope and terms and conditions, but we're not looking at something here which is traditional. This is very much emerging, and I think it really definitely calls for a revolutionary approach to how healthcare companies and individuals are buying their insurance and what type of insurance products they're buying, and really just assessing it and second guessing it and saying, actually, the coverages that I'm purchasing here, are they fit for purpose? Do they really reflect the services that I'm offering now? I mean, during the pandemic, we've seen a surge of demand for telehealth, right? And there are a lot of sort of unscalable models and providers that have switched to an online sort of telemedicine consultation, but they often sort of lack technological understanding or capabilities, and what we've seen is systems to falter. There's been sort of delays in patient interactions, and then there's also been misdiagnoses to occur. Now, a lot of traditional solutions will not be built for those types of emerging risks or claims, and I think the key thing here is that the solution that we put together, and we launched it 3.5 years ago, pre-pandemic, but this is very much going to be the delivery mechanism, or the primary delivery mechanism for healthcare providers going forward. That's what we're envisaging.
Well, let's talk about that and give the audience a little bit more detail on it. So what they're going to be familiar with, Tim, is they're used to purchasing a med mal product that obviously is their professional liability for the medical malpractice, general liability for whatever type of practice or facility that they have. They probably have some cyber, and they've probably questioned, hey, since COVID, I'm doing more telemed. Where does that risk fit? And then maybe they're a more traditional shop. They're not doing any telemed, but they do have more high-tech equipment, more ways to digitally interact with their clients and patients, and they need to make sure that that risk is covered.
Yeah, absolutely. And I think there are loads and loads of different facets. You've hit the nail on the head there of sort of technology enhancements that are being used within the healthcare facilities now. And it's not necessarily just a platform, a technology platform that they're using. They may also be using wearable technology as well to monitor patients' conditions remotely. But I think from an insurance perspective, I mean, we could talk about this or I certainly could talk about this for hours. I'm very passionate about it. But the bit that I always hone in on is this sort of malpractice piece. And to me, the way that medical malpractice policy forms have been built for the last 100 years have been fit for purpose, because that's how companies have offered their services in person. They have policy triggers which are arising out of sort of medical or a healthcare incident, but they don't address any injury to a patient that's caused as a result of something that goes wrong with the technology, or even a cyber attack. And a good example of that we saw with a German hospital quite recently, where there was a cyber attack. It encrypted the hospital systems. They couldn't access their medical record, and therefore they couldn't prescribe medications to that patient, and they ended up passing away. So that would be a good example of bodily injury to a patient arising out of a cyber attack. Now, traditional policy forms don't give you any cover for this, and that's partly why we launched this policy form, because we have all of these new sort of 21st century coverages built together on one specific policy form.
Yes, and that is the difference that I see between what you have and what we're doing from a more traditional sense. Now, Tim, we when we do these, we like to move into, we always get the question of put it in terms that I can understand of why I would need this. And that's when we move into different claim scenarios. In our MedMal podcast, we did that and had a lot of feedback and questions on that. So in this sense, give the audience an idea of some claim scenarios where the traditional siloed approach may not work and what we're talking about here would work.
Yeah, and I think the difficulty within this space is obviously it's new, it's emerging, and many insurers will turn around and say, well, we've got no claims experience on this, so we can't give you any good examples. But I think one of the things that we learned when we were researching this as a project is we have a deep understanding in healthcare, we have a very deep understanding in technology, and we have a very deep understanding in cyber as an organization. So what we did is we pulled all those resources together and we modeled it and said, hang on a minute, well, these types of companies, healthcare companies that are delivering services electronically, should have these 3 pillars of coverage. And we can roughly deduce what types of claims they're going to get based on our experience in those 3 pivotal areas, right? Because a healthcare provider that's been offering services in one way for the last 10 years is not going to get the same types of claims that they will do for the next 10 years because the services have been delivered remotely. And that's certainly where we think we're going to see more claims, and it will be the emerging claims, right? So if any companies are starting to leverage artificial intelligence, that would be one of the key areas. So if you have any radiologists who are using a piece of artificial intelligence technology to analyze CT scans and are making a diagnosis, what we think will happen in the fullness of time is if a claim does come in, it'll be very difficult to point the finger at the provider or the technology producer. So often they'll point the finger at both companies, and you'll be left to defend it as well. So at the very least, you need some defense coverage under your policy. I think the other thing as well is because of the pandemic, privacy controls have certainly weakened. So we've seen lots of healthcare systems rapidly sort of rolling out technologies to provide broader access to care. And sometimes, unfortunately, they've neglected security in the process. I mean, they've had a relaxation of their firewalls and remote working capabilities. And often providers do also struggle to adhere to sort of basic compliance requirements. So as a result, we've seen a huge spike in cyber-related issues as well. Which we think is a key reason why companies shouldn't be buying just a small bolt-on cyber policy with a very tiny limit. They should be buying a full limit policy with some good sort of claims handling and infrastructure that sits behind it to assist them.
Let me jump in there, Tim. I'm sorry to interrupt, but I want to make that point because as I go through and talk to SMA members and look at their property and casualty portfolio, a lot of times they'll say, I don't need a full go cyber policy. I have a tacked on limit either on my general liability or on my MedMal. And what Tim is saying is a lot of times that little bit of coverage is just a sub limit, maybe $100,000 or $10,000, or not enough to really make a difference. It's just there so that the carrier can, they can max that claim out and move down the road, because those claims are normally going to be much more from a dollar figure standpoint higher than that, and you need to have that specific cyber coverage. And Tim can expand on this, but the definition of what cyber is expanding on a daily basis, as it's not just hacking into your system to get patient data. It's ransomware, it's locking your system, it's all the different things that come in a true cyber exposure.
Yeah, and I think ultimately, when you're buying cyber coverage now, you're buying it for the claims handling. So you're buying it because you have an insurer who has A, the experience, and B, the resources, and they can do it at a much lower cost versus going out and sourcing your own attorney who could potentially handle it. I mean, I think the other key point is whilst the limits might well be there, and they might be 50 or 100 grand, the coverage tends to be quite weak, because as the sort of one of the foremost cyber insurers, we like to update our policy forms every quarter, and that's how fast the industry is moving. You hit the nail on the head there when you said that it's not just about how many records you're holding. There are all of these other emerging risks within cyber, and the last thing you want is to buy a cyber policy and for it to only sort of cover 10% of the types of claims that we're seeing now. We like to make sure that you've got the adequate coverage in place for all types of losses.
Tim, in the time we have left, one thing that our audience probably doesn't think of very much is the tech side of this, and what the tech coverage is there for. Why don't you give them just a brief tech coverage 101 on and how it may apply to a medical practice or facility?
Yeah, and it hugely depends on exactly what your organization is going to be doing and how you're going to be interrelating with pieces of technology. But I guess simplistically, if you are offering your services across a technology platform, then in theory you have a tech errors and omissions exposure. If you are creating any content as well that is on a piece of technology, you may well need coverage for intellectual property rights infringement. And I think the key here is that a lot of companies think, they look at it and they're like, well, we're not a tech company, so we don't need any of that technology cover. But there are other facets to your organization, your exposures, which will require you to have that. So if you sign up any contracts with private payers and you're offering healthcare services electronically, they'll now require you to have technology, because they know it is one of the foremost exposures. I mean, you asked a good question earlier, James, about give us the real sort of basic terms as to why you should have this policy. Well, I think the key here is that it brings together all of the key exposures that companies will face when they're offering telemedicine services, and it also has some really good unique add-ons as well for things like board action complaints as well that you wouldn't traditionally find from your standard medical malpractice carrier.
I agree, and I think that's the best way to leave it there is your standard coverage. That's the point that I want to get across to the audience today is your standard coverage sufficient? Possibly it is. Maybe you're not doing anything outside the box and what you've had for 20 years is proper. Or things have changed, you've changed the way you're running your practice, and you need to have it reevaluated. And that's what we can do at the SMA. We can come in, take a look at it for you, and just give you some reassurance. We may not make any kind of product offer. We may say you're in the right place, or we may say you need to take a look at something like Tim has here, and it probably is the way the future is going to look. Tim, any parting words before we end the podcast?
No, I mean, you're absolutely right. The refresher is the key here. I think we just have to keep challenging the status quo. What was fit for purpose for the last decade certainly will not be fit for purpose for the next decade, because guess what? Things have changed. They were changing pre-COVID, and they have 100% changed on a widespread basis now because of COVID. So there should also be an introduction to sort of digital healthcare insurance as a guide that we can attach to this podcast as well, which should give you some good insight into the types of coverage, why you should buy it, some claims examples as well, which are real world life claims examples. So
definitely check the show notes for that. Tim, thank you so much for joining us.
No problem. Thanks for having me. Appreciate it.
I'm James Richardson, SMA Program Administrator. Find me at sma.org. Tim Boyce with CFC. Thank you for being here, and thank you for joining us.
Thank you again for joining us. To subscribe or to listen to additional SMA podcasts, please visit sma.org/podcasts.